Medical practitioners, pharmacists and dentists union 2 days to come up with an agreeable return-to-work formula. The two parties are in a meeting to beat Wednesday's 2:30 p.m. deadline. KMPDU, on the 55th day of a strike, presented a separate document from what the government presented before the Labour and Relations Court, prompting the judge to issue an order to have the two parties deposit a signed return-to-work formula by Wednesday, failure to which the court will make a determination on the matter. As Emily Chebet reports, the Kenya Union of Clinical Officers was on the streets on day 37 of the clinical officers' strike. The clinical officers demanding the implementation of their 2017 collective bargaining agreement.
For the last 37 days, members of the Kenya Union of Clinical Officers who work in government health facilities across the country have been away from work, citing discrimination by their employer.
We are here to stand together with our brothers and sisters under universal health coverage who are being discriminated by being paid a salary that is not commensurate to the work they are doing. We are here today also to stand against wage reduction.
The devolution, where we say that health was devolved, is a confusion to health management, and it is the reason why we continue having strikes that have no answer, because the president continues saying that health is devolved, and the Council of Governors say they have no money. So who has money to solve the issues of the healthcare workers?
The clinical officers are demanding a better working environment and the implementation of the 2017 collective bargaining agreement that increased their risk allowance from 3,000 Kenya shillings to 15,000 Kenya shillings. They are accusing the Salaries and Remuneration Commission of delays in implementation of the increment.
We have our colleagues who have really suffered after contracting infectious diseases in line of duty. Like one of our comrades who is also an official from the Kajiado County, but could not afford health care that he himself provides.
Tunataka ile career progression yetu ipitishwe na Public Service Commission kwa sababu wamekuwa nayo tangia mwaka 2017 mpaka leo hii.
The clinical officers are accusing the county governments of intimidation and threats, adding that they will continue with their strike until all their demands as stated in the strike notice are addressed.
The county government of Kisumu, Kisii, Embu, Kiambu, Vihiga, and any other that is willing to join that league like Machakos, where they have stopped the salary for the healthcare workers and they continue to issue show cause letters to intimidate our workers. Clinical officers are not going anywhere, and they are not going to be cowed because of your punitive engagement. We want to ask you, use that energy to address our issues, promote our people, employ clinical officers, and then we'll walk back to work and Kenya will enjoy services.
Kenya Medical Practitioners, Pharmacists and Dentists Union and the government through the Council of Governors and the Ministry of Health are in a meeting to try and come up with a return-to-work formula by Wednesday afternoon as directed by the court.
We have a return-to-work formula that we believe befits calling off the strike. But then the government, both the Council of Governors and the Ministry of Health also have return-to-work formula that they feel that they befit calling off strike. So we want to go sit down and analyze these particular documents so that we can come up with a common document that actually complies to our collective bargaining agreements and addresses the issues that we had raised as a union that has made us to be on strike for now 55 days.
The two meetings are the latest attempt to solve the problem. Several other similar meetings have ended in a stalemate.
Solidarity forever.
Emily Chebet, Citizen TV.
Makes us strong.